Good morning, dear students. Today is a lecture dedicated for intrauterine infections. If we'll give definition infectious disease and process, it is that caused by pathogens which have entered the fetus from an infected mother before delivery or during the passage of the fetus through the birth canal are combined in the concept of intrauterine infections. What about epidemiology? The prevalence of the intrauterine infection among newborns is about 10%. However, only 10% of infected newborns will become during the neonatal period. In other children, intrauterine infections is asymptomatic or has a difficult diagnosed clinical symptoms. The source of infection, as a rule, it's pregnant woman. The factors, the most dangerous pathogens of infectious disease that a pregnant woman first encountered during pregnancy, because during this period the primary immunity is modified, while the secondary immunity is preserved. It's essential to identify seronegative women before pregnancy. There is some shown mechanism of infection during HIV infection. Risk factors for intrauterine infections, it's burden to obstetric history, stillbirths, miscarriage, abortions, especially during the first pregnancy. Chronic disease of urinary system, chronic disease of reproductive system, acute infections disease during pregnancy, respiratory maybe, acute tonsillitis and bronchitis. Pathways of infection to the fetus, hematogenic, descending pathway and ascending pathway. There is congenital prenatal infection and postnatal infection pathway, showing the mechanism of infection. So, pathomorphological characters of individual stages. First phase, it is phase blastogenesis or blastopore. Second stage, it's embryonic development phase or teratogenic effect. Intrauterine infections may affect such kind of teratogenic effect to the baby. So pathomorphological characters, individual stages, early fetal period, the fine structural definition of the tissue, inflammatory reaction maybe with alteration and proliferation. Late period, fetal maturation, inflammatory reaction with the alteration and proliferation, exudation. Consequences of various infections shown in this slide. Intrauterine infection periods. First, it is incubation period of clinical manifestation, remission, recovery, and residual period, or period of residual manifestations. Some teratogenic effect of infections, like cleft lips, defect of fingers, and localized form purulent conjunctivitis and purulent omphalites. Common symptoms of prenatal infections, it is hepatosplenomegaly, jaundice, exanthemus, maculopapular, maybe petechial and draining, hemorrhagic, some rashes on skin, pneumonia, purulent lesions of the skin and fat tissue. And common symptoms of prenatal infections from nervous system, meningoencephalitis, calcification of the brain, osteoporosis, chorioretinitis, and thrombocytopenia and anemia. Sepsis. It is a cyclic disease which is based on an organism's systemic inflammatory response of an immune complex to the bacterial infection with the development of multiple organ failure. Multiple organ failure syndrome, it is from respiratory tract, acidosis, hyperventilation, respiratory distress syndrome. From cardiovascular system, decreased cardiac output, vasoconstriction, organ hyperperfusion, and refractory hypotension. from kidney hyperperfusion, damage of renal tubes. Multiple organ failure syndrome from liver, increased bilirubin and transaminase, mental status, agitation of or inhibition, loss of communication skills, anorexia, convulsions, hematological indicators, leukocytes, toxic granulary, thrombocytopenia, CRP, and monocytosis. Clinical pictures, cardiovascular system will be present with bradycardia or tachycardia, cyanosis, microcirculation disorders, white spot symptom, capillary blood filling time more than 3 seconds. Arterial hypertension late symptom, it's severe peripheral edema. Clinical pictures, GI tract, lack of appetite, slow evacuation of the food from the stomach, regurgitation, vomiting, liquid watery stool, traces of blood in the stool, swollen belly, and enlargement of the liver and spleen. Clinical pictures, nervous system, unusual behavior, drowsiness, hypertension, inhibition of physiological reflex, swelling of the large fontanelle, and convulsions. Clinical picture from skin and subcutaneous tissue, dry baby, dirty baby, marbling pallor, jaundice, petechial hemorrhages, and sclerema and sclerodema. Clinical pictures, thermoregulation, instability of the body temperature, hypothermia, increased body temperature, prolonged increase in body temperature is usually sign of infection. If 3 is infection and increase in body temperature is accompanied by other symptoms. So, metabolic disorders, hypoglycemia or hyperglycemia. Hypoglycemia or hyperglycemia, metabolic acidosis, hyperbilirubinemia. It is as a significant part of its direct bilirubin. Hematology, 50% of cases have a normal white blood cell count. Leukopenia is more common in premature babies. Quantitative changes in neutrophils, a more sensitive sign in 75% of patients. The ratio between young forms and all neutrophils, more than sensitive indicator of sepsis. And thrombocytopenia, more than 8,000 for 100 light signs. Biochemical analysis of blood, the concentration of S-reactive protein in the blood increased in 15–90% of patients with sepsis. S-reactive protein is an acute phase of inflammation region that has a short half-life and quickly normalizes with adequate treatment. It usually occurs after 24 hours from the moment of infection. So the microbiological examination, cultures from the surface of the baby's skin may indicate colonization of the mother's birth canal. For the diagnosis of neonatal sepsis are not suitable. Bacterioscopy and inclination of the bacterial aspirate for differential diagnosis of RDS. Urine culture is not very effective for the diagnosis of early sepsis, but it's more informative for late sepsis. So treatment of neonatal sepsis, it's necessary to start the same time with the mother's treatment in cases chorioamnionitis in mother, prematurity, increased maternal temperature, or waterless period within 18 hours, mother's urinary tract infections, carriage of group or B streptococcus during pregnancy, and previous childbirth with streptococcal B, most cases, infection. Antibacterial treatment, symptomatic and post-syndrome treatment, intravenous immunoglobulins, transfusion of granulocyte mass, replacement of blood transfusion, introduction of recombinant human cytokine and or colony of granulocytes, macrophages of the stimulating factor. Antibiotics start antibiotic therapy as soon as possible. The choice of antibiotics depends on the microflora, age of newborn, clinical symptoms, and the time of infection. If hospital infection is suspected in newborns, the choice of antibiotic therapy is determined by the most common nosocomial infection, taking into account the epidemiological situation in the department of current hospital, admitting hospital. So neonatal sepsis should be treated with the intravenous antibiotics. Standard intravenous IG, intraglobulin, F, human immunoglobulin, immunoglobulins, osteogam, stand globulins, endoglobulins, and vegan liquid. The immunoglobulin enriched with pentaglobulin and specific immunoglobulins, hepatect, cytotect, and anti-staphylococcal immunoglobulins. This was all for treatment of septic disease. In case of intrauterine infections, our lecture is over.